Welcome to Biztech Health and Wellness Show presented by IJN, the National Heart Institute of Malaysia. The show where we focus on equipping you with knowledge on health and wellness to help you ensure a more productive and healthy lifestyle for yourself, your family, and your employees. I'm Dr. Selina, and today the conversation is about adapting to the COVID endemic with telemedicine. And to bring us insights on this topic, we have Dr. Raymond Choy, co-founder and CEO of Doc2Us. Now, Doc2Us is one of Malaysia's leading telemedicine platform. Welcome to the show, Dr. Raymond.
Hi, Selina. Thank you very much for having me.
Hi, so Dr. Raymond, can you give us an overview of your professional background as well as what Doc2Us does?
Okay. Let me bring you through. Who am I, right? So, professionally, I'm a medical practitioner. So, born and bred in Malaysia, and subsequently, blessed enough to go to the UK to continue my medical degrees and did my training a few years over there in Oxford, and then subsequently I went to Singapore to continue my practice for 7 years. As a medical practitioner. So that's my background as a medical practitioner for more than 10 years. And, during my tenure in Singapore, because I think I'm sure you and I also will agree that, as a medical practitioner, a lot of your friends and families, always come to you and ask about general medical related questions, right? And, those days that they used to send us, those days I was in the UK, SMS, right? And then subsequently to WhatsApp, to even video call. And, then it just got me thinking one day, right, that what if those people without such access, right, where do they go to? Do they go to the clinics or hospital or Google, which sometimes might not be personalized or even reliable? And hence, because of that actually, started, having this kind of a thought of, why don't we create a platform for people in Malaysia to really, engage and be connected to the healthcare providers so that they can actually get their questions answered in a more professional and evidence-based manner. So we actually founded the company back in 2015. And why do we call Doc2Us? Because we really want patients to talk to us, right? You want patients to talk to us. That's why it sounds like, talk to us. So Doc2Us. So we founded a company in 2015, and as a first-time founder, and with no business acumen, no experience in business. So we took 20 odd months, honeymoon to actually build the app, right? So we knew we wanted to build the app, right? So that you can actually have a platform to connect, patients to healthcare providers. And without the technical background, right? And because my co-founder is a business side, right? The corporate side. So this is where he can actually fill up my shortcoming, right? My skill set gap. But at the same time, I have another skill set gap, which is the technical side, right? You want to build an app, you need a developer. So we actually engage with our one of the top developers in Malaysia, Atmos Studio, and I pitched to him. We sent a proposal to him, and 1 week later he called me back and for just a quick chat. I remember I was pitching to him 1 week later on an ambulance. I was on standby. Right? I used to work in Singapore Airport, which is a 24-hour medical center. So I was on standby, actually, waiting for a flight to come in. There was one patient unwell on board, right? So I was with my paramedic, with my nurse in the ambulance, but the flight was, I think 1 or 2 hours, late, right? Delayed. So we were in the tarmac. So AK, the CEO of Atmos Studio, called and said, we are very interested in healthcare portfolio. Do you want to tell me more about your idea? So in the ambulance, I took 15 minutes to pitch to him about Doc2Us. Then they got excited, and then because of that, we joined venture, and he being part of our shareholder, and from there we actually built the system and the app, and luckily actually in the end we launched it in 2017. So we have been in the market for 4 years, and for Doc2Us, we first started as a telemedicine platform back in 2017, where we offer online consultation services to the patients in the public segment. And of course, back in 2017, that was BC time, right? Before COVID time, right? So during the BC time, right? And people actually did not know the value of online consultation, because in Malaysia, right? Going to clinics or hospital is actually not a big issue in major cities, right? So accessibility is not the problem, it's not the pain point. And why would people, spend money on online and might not even get a single pill of Panadol? So we were a few steps ahead of the general population, and the traction wasn't that great, right? And because of that, a few months later, we realized we can't continue to provide what we provide, right? So hence we have to pivot. So, a few months later, we pivoted to serve the B segment. So we are fortunate enough to actually, work with the very first pharmacy partner who actually believed in digital health. And that was, Alpro pharmacy chain. At that time, there were only 30 plus outlets strong, right? So, the CEO believed in this, and I remember, they came all the way to Singapore after I sent the deck to the HQ. They came to Singapore, and then we had a chit chat, at the Starbucks. And from there, we built the relationship that, we want to work this together to disrupt the whole, community care level in terms of pharmacy. So hence, we actually built a pharmacy solution, incorporated telemedicine element into the pharmacy, right? What does that mean is actually, right now, all the pharmacy partners that we have, you go in, you have a virtual doctor with the pharmacist to serve the clients. And we have the doctors readily available to actually prescribe on the spot for the walk-in patients in all our partner pharmacies. So to date, we have more than 600 partner pharmacies, including Alpro pharmacy, who grew exponentially, as well as Watson's, big pharmacy, AM/PM pharmacy, and we are on target for 1,000 pharmacy network by end of this year. And these are all our subscribing pharmacy who actually believe in the digital prescribing and digital dispensing solution. And because of that, 2018, we actually, of the B segment that we serve, we are fortunate enough to actually, serve the corporate clients. Our very first corporate client was Hong Leong Bank. And at that time, none of the corporate clients in Malaysia were using telemedicine for their medical benefits of their employees. And that's a bit few steps ahead, right? Because you go to the panel clinic to see doctor, right? And Hong Leong Bank was brave enough to take on the challenge, right? And because they saw the values in telemedicine, in telehealth, right? And of course, in partnership with the MyCare, the third-party administrators, to make this work. And first year, 2017, when we rolled out, we only did less than 500 e-prescription whole year, right? And 2018, the second year, we started serving, pharmacy as well as Hong Leong Bank. We actually recorded 5.5K e-prescription that year. So that's quite a good, significant jump, right? And 2019, because there was more corporate clients, they saw Hong Leong Bank, they saw more pharmacy. So we actually served more corporate clients, more insurers clients, as well as more pharmacy. In 2019, actually, we grew to almost 90,000 e-prescriptions generated that year. And last year, because of pandemic outbreak, we actually grew more than 160% to more than 232,000 e-prescriptions. And
what does that signify for you? I mean, surpassing that 500K e-prescription mark, what does that signify for doctors?
Well, that's a very good question, right? One is actually, it means the adoption rate has improved, has increased, not only from the pharmacy, but also from the consumer, which is the employee and the public patients. And two is when you have so much of e-prescription in your database, we actually have a better insight and analytics and to understand the behavior of patients towards their medication and their compliance. And this is what we are working on. And even though as we speak right now, every 1 minute we are actually generating one e-prescription by our online doctors, right? And because of the cloud computing, we partner with Microsoft Asia, we're able to scale up so fast, right, to actually onboard 1 to 2 pharmacy outlets every day, right? With this, actually, we are able to actually, build a very solid, network pharmacy, right, to better serve our clients, to better serve our patients in terms of the last mile delivery, dispensing part, and also, patients' education on the medications and its related matters. And hence, surpassing these 500,000 e-prescriptions, I think is very crucial for us, and it validates what we believe in initially, and we grew, slowly but surely that people started to see, the values of digitalization, especially when it comes to prescribing and dispensing. All this while, you and I are practitioners, we used to do paper and pencil, right? And you and I know that there's so many, problems about that, right? The communication gap, the how clear is your message to the nurse, right?
Yeah,
To
the writing, the doctor's writing as
yeah.
well.
I'm not sure about you, right? I'm very guilty about it sometimes, right? Because doctors are always very, busy, right? They see so many patients in the hospital and clinics. Hence, their writing has to be fast. And then so fast, sometimes it looks like worms,
Yes.
right? And that might compromise the patient safety and the drug safety. So when we have a proper system, everything clearly stated, right? That, Panadol, how many doses, how many days, it's clearly stated, communicated around the ecosystem in real time, right? I think that is very powerful. Yeah, and this is what we have been doing to digitalize the whole dispensing and prescribing processes. Yeah.
Who are your other key providers that are providing these e-prescription services, and how have their presence in this ecosystem contribute to helping you build that awareness and therefore the acceptance of this e-prescription among Malaysians, like what you mentioned earlier?
Yeah, thanks for the question. I think with one party like ourselves, definitely we cannot, do on our own, and we cannot roll out to this big. Definitely is a multi, sectorial, involving so many stakeholders. For instance, the pharmacy stakeholders. So they have to believe in this because they do not need to. This is not a need, right? For them, they've been dispensing, with the paper prescriptions, right? All this while, why do I need to pay, to disrupt my own practice, right? Right. And someone need to ask more questions on the patient side when they walk in, all this. So we created the need for them, right? We actually make it more legitimate, clearer and safer in terms of drug dispensing, right? So pharmacy is a very, very important stakeholder. The second stakeholder is actually the policy maker, right? And in terms of policy maker, with Ministry of Health, with MCMC, our e-prescription is in full compliance to the Poison Act, as well as the e-prescription where requiring a digital signature system. And we were the first one in the market that actually offers such solution that is in full compliance with the Ministry of Health when it comes to e-prescriptions, right? Right now, there are other two players who are actually in compliance using the digital signature system, right? And third, of course, the digital signature system provider, where in this space, we actually work closely with Trustgate, MSC, which is accredited by MCMC, right? And fourth, of course, insurer company, who actually believe in this, and patients, right? As well as the pharmaceutical companies. So we work closely with pharmaceutical companies. So in the ecosystem, there are all the P's, right? So we have a payer, right? Patients, providers, right? As well as policymaker. So we definitely, in short, we work with these 4 P's. Yeah.
It sounds like a lot of people are involved in growing this. It's really interesting to hear this. So how has Dr. S played a role in the battle against COVID-19 in Malaysia?
Okay. As a telemedicine player, since 2017, that was before COVID, right? So we have been, paving ourselves into raising awareness on telemedicine, online consultation. It was a very tough journey because no one knows what's telemedicine. They don't know what is the values of it. Why, how would you examine the patient through phone, through video consult, right? So all these questions, skepticism, all this, right? And because of COVID-19, actually, and due to the lockdown, right? People are not able to go out, but they need to refill prescriptions, right? That's where they find alternatives, right? And hence, they actually found telemedicine. Hence, the adoption rate during pandemic outbreak actually skyrocketed. In China, it was as high as 900%. Some of the players in 900% adoption during pandemic outbreak on telemedicine. That's crazy, right? And in Southeast Asia, for instance, Indonesia or Singapore is as high as 150% on average, right? For ourselves, we're looking at 70 to 90% during this pandemic outbreak in terms of adoption. We are not as fast as like China and other countries, all right? But definitely, I think we are moving towards that in the shorten the process in about 2 years time. So during this pandemic outbreak, right, and because of the telemedicine, and we actually in March last year, we rallied more than 120 over voluntary healthcare providers to step forward to offer free virtual health advisory to public to provide online real-time messaging services using our platform, right? So this is a free services 24/7 offer since last year March, right? Because when we first started in March, right, people were wondering what is actually COVID-19, right? Those were the questions we were asked, right? And how was it, contracted? Should I wear mask? Our public health definitely needs a lot of, improvement, right? So there's so many questions about COVID-19. And as we go in June, July, different questions arise because people started to get used to it. So in July, actually, we were quite blessed, and that we worked with the Ministry of Health, and we integrated with the MySejahtera on our virtual health advisory in the digital health side to provide continuous kind of a virtual health advisory to the public, even till right now today. So so since last March until now, we have clocked more than 1.7 million hours on providing virtual health advisory to the public in Malaysia on COVID-19 related matters. So even till right now, we are still answering them questions. There was a period there people asked about vaccine, right? And now actually people are asking more on quarantine at home. A lot of them are positive. They need some answers, and they're not sure about whether their family needs to be checked or not, right? So we act as a bridge between Ministry of Health and the patient, because sometimes there might be some backlog due to the overwhelming load, right? For the government, none of the government in the world are able to deal with thousands of cases a day, right? So we are trying to step up, right, and to provide these services to shorten the gap, as well as to try to reduce some of the loads of KKM, the Ministry of Health, and this is what our little contribution to the country. And this is all voluntary service. As a platform provider, we don't pay our healthcare providers. What we did, we sell them the mission statement, right? Really, everyone, if you are free, come and help, right? So we are quite blessed to have more than 120 over, from specialists like ID, infectious disease, specialists, all the way to GP, dentists, nurses, really want to come and help. And we have a task force chat group, right? Whichever that you're not sure about the latest protocol, we always have people to help, right? Hence, we are giving out, evidence-based, information, the latest updated, information to the public. And this is all for free. It's all available in your MySejahtera under digital health. You can find Talk to Us there. The last part will be, we were blessed enough to actually, work with government and to help setting up, PPV, a vaccination center. So in June, we started with 1 mega PPV in Setia City. And subsequently, actually, we work with the different, Selangor government as well on the Southwest program. So we have actually, managed more than 40 PPVs, vaccinating more than 800,000 doses for the people in Malaysia. And these are all the small little efforts and initiatives that we try our best as a startup, as a health tech startup, to fight against infection with the people and with the government as well. Yeah.
Well, kudos to you and your team. I mean, to be able to rally the entire country together, all the healthcare providers together to really fight this. Because I do agree with you that the government could not have done it all by themselves. I mean, nobody can. So it's a very good job what you guys did, But now that we're moving towards living with COVID-19 as an endemic, how do you think telemedicine can and will complement the current ecosystem, and with the adoption from the healthcare providers, that there's a bit of resistance, mostly from healthcare providers as well, how they think we must see the patient and touch them. So what do you think how do you think this can complement?
Yeah, I think that's a very tough question on your second part. Let me answer your first part first, right? I think, yeah, you're absolutely right? So COVID-19, we are working towards the endemic era, right? So, interstate travel allowed now, right? Economy opening, a border is going to be open very soon, right? So then, the $1 million question is, how can digital health solution, right, continue to thrive, right? And in my opinion, is the awareness and the values. Actually, people already realize how good and what can the digital health or telemedicine can do, right? So definitely there will be some changes when people are able to go back to school, go back to work, right? And they are able to visit their GPs or the specialists, right, in real. Definitely there will be some dip in terms of adoption. But I think not only me, I think across all the telemedicine players, I think we are very positive in the future, and which shows in other countries, right, that people actually continue to adopt the solution because it's more convenient, and it's more cost effective, more accessible, more available, right? And it's really about how you actually can bring up more value to patients outside the clinic and hospitals. We are not here to replace the hospital and clinics. right? We are here to take care of the patients remotely outside the clinic and hospitals. And how can we continue to bring this patient back to the clinic and hospitals with more standardized data back to the clinic and hospital for the benefits of the patients, right? And the providers, of course. Yeah, but again, like you pointed out, right? And providers, healthcare providers, because it's not in our training all this while, right? We are very analog, right? If I may put it that way, right? Our practice, our training has been very analog, right? Traditional medicine, right? So to speak. Hence, to move them into the different mindset, it takes time, right? Of course, there are early adopters. They are, those people who follow the herd, and of course, there are late adopters, right? And definitely, it's really about awareness and education. It's like we bring you a kid, bring a kid, right? A bicycle, a two-wheel bicycle. We ask them to cycle. They will not be able to cycle. You show them how to cycle, they will still be skeptical whether they can balance or not, right? You can give them a lot of manual SOPs, right? This is how you cycle, but they will never be able to cycle until they hop on the bicycle, they try, right? With the supervision in the controlled environment. Even when they fall, they won't, bleed severely. It's still within the controlled environment. They need to feel it before they learn it, right? Only then they'll be able to master it. So likewise for telemedicine is the same, because from far they see a lot of skepticism. How can you, check the throat? How can you, diagnose remotely, right? It's really about awareness and education. A lot of things that we can't do. There are a lot of limitations, but once you understand the limitations, actually, telemedicine can do wonders, right? And that's why we believe in the hybrid care. How can we bring online to offline, offline back to online? And if that works very well, this hybrid care model will be the maximal benefit to the patients and the providers. So hence, I think we need a lot of hand-holding with our healthcare providers together. We are not going to leave anyone behind, but it takes time. Different group of healthcare providers at different timing, right? But we just need to continue to educate and to tell them how to cycle, but you need to hop on and we cycle together. We handhold together, and you will be able to understand and master telemedicine and the beauty part of it. Yeah, I'm not sure if I answer your question, but this is how I see it. Yeah.
Yeah, you're right. It sounds like there's a lot of hand-holding. Even when we first started out our medical journey, also it was a lot of hand-holding. You do something and then you look behind and ask your specialist whether it's okay or not. So I guess what you're saying makes a lot of sense. So moving forward, you're expanding to Myanmar. So why Myanmar?
Yeah, that's a very good question, right? And a lot of people ask the same question. So in August this year, we actually officially launched our Hope Telecare in Myanmar, working with the local partners to really serve the healthcare needs of the local in Myanmar. And the discussion, the partnership discussion actually started before the military coup, right? And of course, after that, they have the military coup and then pandemic outbreak. And our partners and us, we decided, I think there's a dire needs of help in the healthcare segment in Myanmar. So hence, I think we say, let's continue to do it. Hence, we launched in August, and it has been very promising. People started using it, and in fact, we also started the digital certificate for vaccines in COVID vaccine in Myanmar as a first provider to do so, right? So definitely there are a lot of innovations going on in Myanmar. And it's a country where healthcare pain points are at its maximal. So there's so many pain points that need to be solved, right? So hence, I think we would like to see how we actually can continue to help the country, the Burmese people, and with the help of the digital health solution, as well as replicating our current ecosystem and the business model that works for us with the hyper localization of Myanmar, of the Burmese market, right? To see how we actually can continue to serve them better and bringing them a more affordable, accessible healthcare services. Yep.
Yes, Dr. Raymond, any final thoughts that you'd like to leave us with before we end the conversation?
Yeah, thanks for having me, Selena, and of course, thanks Biztech Asia for having me. And I think my final thought would be, I think everyone has been working really hard in this pandemic outbreak. There's so much of sufferings, but I think we have started to see the new beginning. We are seeing the end of the tunnel, right? So continue to stay strong, And most importantly, I think we haven't won the pandemic outbreak yet. So continue to say, to follow the SOPs and keep fighting really. So to all the healthcare providers, a big salute to you guys, the frontliners, right? And for continue to serve the country, to help our patients, our people in fight with this pandemic outbreak. And yeah, so that's what I want to say. So stay well and stay healthy, and we will win this fight soon.
Thank you, Dr. Raymond, so much for your time to be on this show. I'm Dr. Selena Chu, and we've been speaking to Dr. Raymond Choy, co-founder and CEO of Doc2Us, on Biztech Health and Wellness Show presented by IGN, the National Heart Institute of Malaysia. This video and podcast will be available on our social media platform and on our website at www.biztech.asia. So please subscribe for our various platforms. Thank you for tuning in.